Hi, Jackson.
Hi.
Good afternoon, Jackson. Yeah. So, Jackson, today's discussion major focus is on consolidation.
Okay.
I think we had enough discussions. So it's more about what would be your 6 months going to look like. So the first part of all our sessions were more focused on maybe having clarity, giving you different perspectives, so that you can arrive at certain conclusions. But
Right.
end of the day, as a founder, it's your decisions to make. We can only be enablers and accelerators.
Right.
So the next series of exercise is what would your 2 quarters look like, and
Okay.
how we can be of help, so that maybe what handholding can be done. What are some of the exercises that you can do, which is very specific to your journey. Okay,
Okay.
so that's what we are going to discuss today. Just before that, were you able to speak to the doctors? And we had discussion last time with regards to specifics on the products that you're trying to build and value offerings that you're going to create. So just want to know, where are we with that?
Right. So I had a chance to talk to Dr. Dheeraj. He's a dentist and also the mentor that is assigned to
Mm.
me from his point of view, and things like what we can grow is in terms of again what is the vacuum in the particular stream that he's working on, and kind of components and products which are probably not available in India. That is one segment. And the second segment is which are totally new, which has a total scope of development, that is engineering from Lohatic, and the medical point of view from the doctor and the dentist. So
Okay.
this is some kind of one nice bright light that we see in this particular domain.
Yeah, but were you able to arrive at some what would be that product that you would want to build?
Mhm. So currently, to start off, so just to be very frank, there are a multiple line of products in this domain, and
Hmm.
when we have not yet decided and finalized as to what will be the first launch product, because currently, to be honest, most of the time and energy is going into the current medical customers that we have,
Hmm.
and the other customers as well, because we will be doing this parallelly with Lohato, and maybe once we finalize the second line management at Lohato, I will be much more available in time and persons to work this along with the doctor.
Okay.
Coming to the product, I think we are still sticking to starting with the standard implants,
Okay.
which is an easy entry into the market, and also testing and all of that comparatively is much more, I wouldn't say easier, but much more accessible compared to other.
Got it. Got it. So how does your 6 months look like in that regard? So, for example, I completely understand that right now your core business, if it is not stabilized, you will not be able to bring the kind of financial records. Even let's say we stagger certain timelines, you might
Mhm.
require some grants to come from certain bio accelerators like
Right.
BIRAC and so on. So that needs to be staggered. Because it definitely won't come exactly when you need it, but you need to still build certain aspects in order for you to become eligible for those kind of grants,
Right.
which
Right.
means that money has to come from certain areas that you're currently working on. So even if I were to kind of split it and say you have a core business,
Mhm.
I understand that right now you are increasing your clientele in order for you to have more revenues there.
Right.
And you would want to now set up this whole support team to ensure that that core business will sustain on its own, and probably put the right set of people which can continue to grow.
Right.
But parallelly, you will see what upgradations you can do in your existing core businesses. So that's one of the reasons I believe that you are, looking at segments like these dental implants,
Right.
which are also high margins, but at the same time gives you an entry which is deeper into one sector. And probably there will be some long term ideas which take some time, but then could be game changers over a period of time. So maybe these are
Right.
usually we look at 3 years timeline. Okay. This is something that we look at 1 year timeline. This is obviously 6 months timeline, but this is current,
Right.
right? So just from your your business sense, what would be likely the timeline for you to finish off your exercise with the building that support team that you're talking about, or what help do you think would you require in that stabilizing the existing business?
Okay, so now I will just give you about 2 minutes brief as to what we have achieved in the recent in the medical domain. As you know, like we are machining components predominantly for the medical and dental markets, and apart from that, we are doing it for the defense aerospace and of lately even for the electronics, because the niche that we have in micro machining which gives us that exclusive access to the Indian market. So coming to the support system that you said 6 months, so we are in line and on schedule to finish this activity by the 15th of June.
Okay.
Yeah, so the thing is in terms of order booking, we have already 4x our last year turnover in the second month itself in terms of the booking, not on revenue, but confirmed orders last year. So we are comfortable from the cash flow and all of that. And apart from that, in terms of upgradation, as you mentioned on the top left, for us, the only now the barrier that we have in terms of our entry into the dental market would be the upgradation. One is the quality management systems.
Okay.
That is ISO 13485.
Okay.
Second part is finalizing of the the right design. As we know, what we are getting into is not reinventing the wheel for the start. It is just to try and test the market as to how this will work in, wherein the designs are going to be standardized designs.
Correct. But design standardization basically means what? So would you want to discuss it with some people and then come to a final conclusion? And that was one of the exercises that we're trying to do this month.
Yeah, right. So the design that we want to get into will be the more of standard dental implants and tools. So the demand for this is ever increasing.
Yeah. So just one point there. So when you're saying this test market that you're trying to do the dental implants and tools, one of the exercises that we would want to do is at least when you're taking time till June, is there proper market research that is done with dental associations, etc., so that we can at least say, perfect, this is the opportunity, this is how much the opportunities, and I at least have these many number of people who are willing to onboard if I'm doing this. So is that exercise done, or is this a pending exercise?
It is a pending exercise, I would not completely done.
Okay. And just for you to finish it off by June, what kind of support or what kind of network do you want in this?
So basically, what we'll finish in June is the second line management for Lohatex present. For the design finalization, we will need someone someone who is a practitioner, clinician, and with good and above average design knowledge.
Sorry, good and average design?
Design knowledge on medical and dental.
Okay. So Karthik, last time whom did we connect? One is Dheeraj. Who else did we connect?
One more is Dr. Nishmita. She said she will reply well.
Yeah, can you just check on that, because both of them are working on dental implants. In fact, Nishmita actually has got good network for implants. Can you just check back on that?
Okay, sir.
So are these guys the right guys for you to talk to, or are you looking for somebody else?
I've spoken to Dr. Dheeraj Shetty, and I think we are okay to go ahead.
Okay, so similar kind of people, if you are able to bring.
Right. And yeah, because if we can get more mentorship and more guidance and advice before, because sometimes unfortunately things can go wrong, and we can burn a lot of time and money. So as to avoid it, I think I would still suggest taking more and more advice, and even if it is a month or two slower, not a problem, but we would like to go steady. And
but what I'm referring to is that at least you can validate the market.
Right.
So I would suggest if you can do that and get into the right associations, because you already have certain products that you're doing for the dental industry. You will not be treated as somebody who is completely an outsider, just outsider who is trying to fiddle into this market, right? So it becomes easier for you to show your previous exercises and see what opportunities are there with these guys. And they might actually tell you, no, no, don't do this. Here is something that you should really work on. That's the largest gap, etc. But for that, you
Right.
might have to talk to 10, 20 doctors before you end up with that kind of a validation.
Right.
Right. Karthik, let's see whether we can get into. We'll go for more practitioners. I think that's no brainer because they might not they might not give him exact on what needs to be built, but they will at least be able to tell here are some gaps that exist. Okay.
Right.
One is that. Second one, can we so I think we can put a lineup of at least 10, 15 people he can meet association.
Okay, regulators, CDS.
Regulators, whom are you referring to?
SLs reason.
Can you just check with Derby Foundation? We will see whether we can. These guys have that CDAC regulators and all. CEDESCO.
Okay, sir.
Okay, so if when is the discussion with the MP going to be, Karthik? Discussion with the MP, when is it going to be?
So after 1 week, sir, after 1 week or 10 days, they didn't give the day, but once are all they will start.
Okay. That's what. So I think in the last discussion also we spoke about creating timelines. So if you are
Right.
able to at least do the first market research, Jackson, that
Mhm.
would be at least before you have the discussion with MP, because the moment you have discussion with MP, you will get that opportunity to be very specific on what your asks are, and
Okay.
that kind of can accelerate your whole journey. But if you're not able to ask what exactly you need, then again it will just get stalled.
Right. I
So
understand.
yeah, what I would recommend is if we can at least do market research before that, okay,
Mhm.
and be very specific, saying that here is the opportunity. Here are 10 doctors who are interested in doing this, and probably if you want to go through certain distribution or network for you to have
Okay.
your implementations done. At least if you know those guys, we can
Mhm.
have that small group, what do you call focused work group that we can create.
Okay.
Okay,
Sounds good.
it will at least help you to make sure you progress along with them. Otherwise, sometimes these aspirations will keep, prolonging.
Right. Right.
Yeah.
Right. I understand.
Yeah. So, what I would best suggest is if we can create the focused work group, let's help you to put up that. So let's do that, Karthik. So we can create a focused work which can have a combination of practitioners and at least some sellers who would also have some market knowledge, saying that here are some gaps that are there.
Okay, sellers in the sense, like
So
they sell
the distributors will be there who are very specific to this. So those guys know what doctors are also asking. So they will
Okay,
know
sir.
some needs in the market and how big is this market going to be. So they will have some sort of a clues. But we need to identify who are those guys. So some of these doctors we can talk.
I think, sir, medical equipment distributors are there.
Yeah,
They
medical
are the right.
equipment manufacturers are there, but I'm just saying, would they share? So if, let's say, for example, Jackson is somebody who is going to give the design IPs to them, and then if they want to manufacture, that would be the best bet. Otherwise, usually those guys will not talk. So that's pretty much.
Another thing, Johnson, I think
Hmm.
during our previous discussion, you mentioned this could potentially be like a platform wherein like we can connect with doctors and dentists from multiple domains, and wherein the engineering can come from Lohatic and the medical requirement or the industry requirement can come from them, and we
Hmm.
can collaborate and
Hmm.
work on probably 3 to 5 products in the next 2 years. And it is all about the time and place wherein one or two hits the major, or comes as a major hit, and that is how things can explode in a very good way. So
Hmm.
I think that is something when I discussed currently with my associate, I think that is something also very much feasible for us because that helps us, work more on the engineering side rather than the clinical side. So I think that suggestion from you was really helpful, and I think
Yeah.
we are really okay to work in that model as well.
Yeah. So, I mean, even if you want to establish yourself in that segment,
Mhm.
what I would recommend is, we need to have some associations with the dental institutions,
Okay.
because the guys who teach in dental institutions,
Mhm.
they actually know what is missing. Okay.
Okay.
Of course, the dental institute guys then some of them are practitioners also,
Mhm.
but these HODs of dental institutions are the ones who are go-to people. Okay, so they do a lot of research. They have to publish papers, so they will keep telling what are the things, etc. They will also be able to identify what are the gaps in the current
Right.
technology. Okay, the only issue with them is, they go to manufacture and they will have to spend a lot of time with the manufacturers, which they might not be the right guys to do. Okay, so that's where the difference is. Karthik, remember one of the BOLPU participant who had come, that jawline, he was fixing it with one external, this one.
Yes, sir. He is.
Correct. So see whether you can connect Jackson to him, because that guy is actually an
Right.
innovator and he works with
Yeah.
the manufacturers already. He has designed certain new approaches. So those are all the
Yes.
guys that you can be in vicinity with. Okay.
Okay.
By the way, Yenepoya incubators, we need to connect them. So let's connect to those dental incubators. It becomes easier for him to talk.
Okay, sir.
Yeah, that's actually one way to do it. So these connections, Jackson, none of these things will be fruitful in the initial stage. But if you show
I
one
understand.
result, right, you will have more doctors participating with you.
Right.
Karthik, one of the things, that FU Innovations, right? I think she's.
Yeah.
Can you just talk to her and see whether you can identify some doctors, because she is anyways an entrepreneur. So I'm sure that she would have somebody in her network who would be interested in this space.
Yes.
Okay,
See,
so maybe yeah, from the
yeah,
KN. Correct, KN code. So just check with her if she is aware of somebody who is in that space.
Yenepoya, who investing?
Yeah, FU Innovation, you have to ask whom does she know? Maybe HOD or some innovative professor in her department who always thinks about creative ideas, but might not have the capabilities to build products. Okay, so once Jackson, you start talking to these guys, right? Then you will become a
Right.
part of their internal teams, and you need to be out there often. Then you'll get the
Yeah.
right connect. That right connect then will take you to places. But until then,
Right.
you'll have to do this probability exercise.
Yeah, definitely. We have the bandwidth for that at the moment. So yeah.
I've always realized that the only way to increase your luck is be everywhere.
Right.
Okay. Fine. So this is one. So from a timeline, if I see at least, till you are stabilizing, let me know if you need some help or exercises that we can do with you in whatever exercise that you are doing right now. If there is some
Okay.
learnings that we have had, which we can share as well. So if you're doing till June 15th, let's say, and we are somewhere in May 11th, so let's say if you have 3 weeks, we can do the best possible outcome is market research. Okay, so
Right.
at you can say here, these are things we don't do. Maybe you can just arrive at certain things that you can do. Okay.
Oh, okay.
To get this, let's have a focused work group with whom you can interact maybe in the next couple of weeks, 2, 3 weeks. Even if you meet, bunch of these practitioners, doctors, academicians from dental institution and incubators. So some
Okay.
startups from those incubators. So let's go to Mudbi as well. Mudbi and NOI Accelerator. So these are two, obvious one. So Karthik, again, do you remember this lady who was doing for dental? She was doing that X-ray thing. I think her name is
From where, sir? Okay.
from Manipal.
I don't remember.
Yes. Yeah, Shruti Acharya. Okay. So she's in Mudbi. Mudbi, of course, I can connect to the CEO directly, but it would be better if he goes through the startups, because the CEO might not connect you to all startups. But if there is already a startup which is doing something like this, it becomes easier for her to connect to the. Okay, so Acharya from Manipal. Again, let's have her connect as well. They are all good people.
Yeah.
They can
It's for
talk.
focus group.
Yeah, this is just for the focus group so that he can start talking to each one of them, and then use these connects to understand this market in depth, because a couple of kinds of people. One, if you ask the doctors, they'll only tell about their profession. So unless and until you are picking some specific areas, they might not be able to tell you. Like, these are not guys who are thinking about what is a gap in the market. It's like they wouldn't. They're just practitioners. They're using what has been taught. Then there are a bunch of people who are researchers who would actually know what is the issue in dental science, right? And they would be the one who would be thinking about what is the gap and what could be a possible technology. But they are not technologists, so they only know what is happening. So they wouldn't be knowing what is the solution to be built. Now that solution Jackson can think of, right? And the third kind of people are people who are entrepreneurial, so they understand where is a gap in the market. But these should be also practitioners turned entrepreneurs. So if you have a focus group like this, it becomes interesting. And fourth focus group is obviously you need access to these regulators, so that you're constantly in discussions with them, at least attend some of their sessions. It becomes easier for you to know what and all needs to be thought before you do this, you start manufacturing, like clinical trials and, ethical clearance committee, validations, and so on. So those things and all needs to be done. So therefore, at least having those, otherwise he'll have to spend a lot of time finding those guys. So let us at least do that exercise for him so that he has that group. And then you can use that group to reach out to the secondary networks. Then it becomes easier for you. Okay. Let's see whether Derby also can help. Yeah. So just let's do this exercise quickly this week itself. Let's give it to him. Let him start talking. At least that way, if you are able to conclude saying that this market is really big, I want to really focus on this market, that clarity is also good enough, Jackson.
Okay.
Okay. And I completely agree. What we discussed, right now, I think it is more focused research plus engineering. If you can start, it is similar to that ODMs that are there, right? Original design manufacturers.
Right.
So if you can look into that also, and then, but you need to have partnerships with people who can manufacture it for you. So this comes in partnership with distributors.
Okay.
So equipment manufacturers who are there, that connect we need to build. But before we get there, those guys will only be interested if you have something to show them.
Right.
Okay. Otherwise, those guys, once you show them something, then they will do their own assessment. What should be the pricing? How big is the
Right.
market? Should they even look into it or not, etc. So that exercise they will do. So before we get there, at least if you have done this exercise, market research, then if you have partnered with some practitioner and built the engineering for it, and you collectively own some IP, then you can go for partnerships and distribution.
Okay.
So that way you're not building too much cost around yourself, at least to start with. And once you have one or two product lines, then I feel that you can eventually look into forward integration, which is into manufacturing, or backward integration into building your own team where you have these guys who are doing the IPs, like science-backed engineering.
Right.
So you can go either forward or backward. Okay. So yeah, so probably this is only that we can discuss. Otherwise, we could have gone.
This is okay. I think this is well and good for me. And I think the inputs are pretty good. So I think, and I think this is realistically achievable by the 1st June, of course. At least meeting, I think, on a real scale, I think even if we can have 3 clinicians whom we can have in-depth discussion to understand their personal gaps or what they are facing. Because when I had a word with Dr. Dheeraj, there is a lot that we both discussed in terms of what could be the potential of this particular association of ours.
Okay.
Right.
Hey, just interesting. Like, how do you have these discussions? So, like, is there a framework that you use?
So now, basically, if Dheeraj definitely had a look at the components that we have manufactured during our interview, and then I've shared a lot of pictures. At the same time, he also shared some pictures of what they are using, and probably asking us whether we can manufacture these particular components. So
Nice.
definitely, it was an affirmative answer from us, because that is something, by looking at it, we know we can mention it, not a problem. And based on that, there is a lot of things that he brought up on the table, saying that, okay, I think if we can focus on a particular, line items and probably launch it in India, or be the partner for an OEM in India, or like an MNC OEM. So these are the particular, opportunities. That's what he's mentioned. And apart from that, I think he's also continuously researching on a lot of dental tools and, fixtures for surgeries and alignments. So he said there's a bigger scope of partnering, because from engineering, definitely he would require a lot of. And I saw that as a very big potential by just meeting one person. So what we bring on the table is complex manufacturing, material management, quality, and the supply chain entire. So that is the thing, because coincidentally, like for our Lohatech business, of lately we got onboarded by SS Innovations, that is a medical robotic surgical device company in India.
Nice.
And already the purchase orders have come in, and the sampling will begin this week. and
Mm.
we got onboarded by HCL Tech
That's
for
it.
their medical division. So,
Okay.
so for both of them, whatever we are manufacturing, we are first in India to make.
Beautiful, beautiful. Good story.
So,
By the way, see, what we can also do is, Jackson, while you're doing what you're doing, right? Let's
mhm,
use these things also to be promoted in BOLPU.
okay,
It will give you wider publicity. And
right, right,
when you go tomorrow, you don't have to explain who you are. And that kind of
right,
like it becomes easier for you to go and talk to the doctors because they already know who you are, which basically
right,
means they should feel it's like an opportunity to come and work with you.
right,
Uh,
right.
versus you going and talking as somebody who is in needing their support. So it should be like they should also feel that
Yeah,
right, partnering with you means new opportunities to be explored.
right.
So let it go that way also. That's a leverage that you can have. So maybe these stories, if you can, maybe give us one of the exercises that we are doing is we will publish your stories in multiple forums. That would be one of the
Okay.
exercises that we'll do. Like, we'll take minutes of videos, your setup, what you're doing, your achievements, those things. So it will kind of give you publicity, but also establish you as a organization that people should definitely talk to.
Yeah, that will be really helpful because there are a few things that we are doing. Probably it is first for India, first for Mango.
Yeah.
One is we are actively part of the Foxconn supply chain for iPhone assembly.
That's okay.
Yeah. So
Okay.
the pool is vast because
Uh,
we didn't stop from stop at only medical or whichever needed micro machining, we went ahead and supported.
nice.
Then for the pacemakers, that's the only Indian pacemaker implant that is Shri Pacetronics from Pithampur, Indore. So all their micro components which connect the heart and all of that are also machined
Mm,
in Mangalore. And
very
again,
nice.
we are the only vendors. Apart
Mm,
from us, it is China or US.
nice.
Then I just mentioned we just completed the development for HCL. We finished their first trial purchase order, and today they approved us for the upcoming production of a
Very nice.
platinum component for their medical device. And
Very
for
nice.
that also, coincidentally, we are first in India to do it because they were surprised with their supply chain. They couldn't find. They were looking all over in Bangalore, in Pune, in Chennai, and finally they were surprised. Like, okay, a place which is not known for manufacturing, we found a machine.
Very nice. Very nice.
So
But
I
what
think
does it
that,
mean? So does
yeah.
it mean that it would require you more capital for you to expand your infrastructure, or how is it?
So now, since we are cash flow positive, right now capital, right now, we are just adding machines like about one machine every quarter, right? So for us, that is sufficient. That pace is okay at the moment. And
Okay.
if it is sudden expansion, capital is required. But more than that, what we have learned is this medical field takes about 12 to 18 months for validation.
Correct.
So since most of our components, what we started, developing 3 years back or 4 years back, we have received the purchase orders last month.
Very nice. Okay. But it will also be your moat because others would not be able to,
Yeah.
they will take some time for them to capture.
So I will tell you something very interesting. So we have our customer called Indomin from Bangalore.
Mm,
So they make a lot of cardiovascular components for Edward Life Sciences, for bigger Medtronics and all of them.
mm.
And for Indomin in India, all the components which are machined, which are below 3 for them, the only vendor is Lohatech, which is from Mangalore.
Very nice. Very nice.
Right. So with that,
So
what we
you're
understood
like
is
the critical supplier of components without which their product won't work.
right, right. Or else they have to get it from China, which is or Switzerland or Germany. So now what we have positioned ourselves as in a unique supplier and a critical supplier. And
Mm,
what happened is recently for Edward Life Sciences, we have got approved as a vendor for a cardiovascular component, which is a tube.
mm,
Now during the audit and the onboarding, they will Edward Life Sciences coming to Mangalore in the month of June
Very nice.
to audit Lohatech. So the team from US will be coming here. And after that, even Indomin can't change us as a supplier.
Correct.
So now this is something which we have learned in the medical. So the
Mm.
patience and the perseverance pays off in a much larger
Yeah, yeah.
way on the later stage.
Yeah, yeah, absolutely, absolutely. So that's one of the reasons why I'm thinking. I think even last discussion that we have had is that what you're really good at is design and engineering approaches.
Right.
What you really need is a constant inflow of researchers.
Right.
So you can have a lot of IPs put and kept out there, which
Mhm.
will eventually help your vendors to look at you as a complete end-to-end outsourcing
Right.
partner,
Right.
right? And that capabilities can actually help you to look business from a long term. So see, one of the things I have realized, because I think Mangalore is also really poised for critical components for Swiss watches.
Right.
We used to make those, 1 mm and sub 1 mm
Right.
components. But
Right.
the issue was they never saw it as a vertical stack. Okay.
Right.
They were very happy doing those parts for these organizations. But
Right.
problem is, you can become a long-term vendors, but your supply will eventually get construed if we are not looking at what are other avenues that we can now use our capabilities for. So that's
Right.
how all your Foxconn is still one of the cheapest manufacturer for Apple. But the reason why they are still the manufacturer is because Apple does not know anybody else who can do end to end for them. And the
Right.
only reason Foxconn was able to do that is that they started with the CRT monitors, which was
Right.
which was started in Korea, and then they eventually moved to Hong Kong. And Foxconn was the only organization which somehow figured out how to do it.
Right.
LG wanted to do it, and LG was completely thrown out of the supply chain.
Right.
They were because they moved from one component to the next component, then they were able to do the entire value chain. Foxconn was never removed by Apple, and today
Right.
Foxconn makes whatever they make, thanks to Apple. And Apple trained the whole team at
Right.
Foxconn. So I'm just thinking, if I just think in those lines, what you are doing as a design manufacturer, you should eventually become if you back integrate a little bit on research and as well, then you
Mhm.
can eventually look into forward integration of manufacturing. You'll become an end-to-end supply chain,
Right.
which I think is going to be more valuable as an organization in the long
Right.
run.
No, we are also in the same lines, Johnson. So what we are planning is not only be a component supplier. So soon we are adding sub-assemblies, we are adding test tool components and some more value-added services to our existing customers. So and what we need not pile up hundreds of machines to achieve that kind of revenue with
Right.
1/4 of capital enhancement. We can take it 100x revenue.
Yeah, yeah. So if I look at it, so what you are doing in Loha Tech, let's see how we can help there. But I
Mhm.
think this whole research and design, unit that you're building, maybe you're doing it for dental, let's say, right now. Let's see how do we associate with, those kind of focus groups itself.
Okay.
And you will not have any restrictions in terms of who can associate with you. It
Okay.
is just that the issue with these guys is they do research, but they don't commercialize their research. You are doing
Okay.
engineering, but without research backing you, it becomes kind of a deadlock. You'll not be
Right.
able to progress really well. So you can probably start with consulting with them, but you can always have some sort of a tie-up where the commercials can be in terms of IP itself. That means you will make money when it goes to commercialization. So those kind of things are not something that people are used to here, and that could be a first offering that you can give them, and you can have a lot of these researchers working for you without you paying for them, right?
Right.
So this I'm looking it as a maybe an entity of its own, or it could because by the way, for these things also, there is a separate registration that you can do. I think 35A or something, which is a
Right.
complete R&D registration. You will have a lot, 100% tax exemption will be there for this. Even if you're
Okay.
buying machines and units for this facility, it will
Mhm.
be highly subsidized or it will be having exemptions. So even if you're
Okay.
importing those machines, your import cost will be very low.
Okay. Okay.
So you can look into how you can segment this industry, and you can always, so for commercialization purpose, you can always transfer the IP to Loha Tech, and Loha Tech can do the commercialization.
Right.
And this
Right.
entity can purely remain. In fact, you can also push money from Loha Tech to this. Right now, you are doing R&D, but I'm not sure how much of that it will be still considered an asset in your, P&L. So you're not really getting any exemptions for it. But if you structure your organization like this, so then you can give a complete exemptions on the expenditures there, For lower tech, you can, because you're spending that money from lower tech to that R&D organization, it will still be considered an expense. So you
Right.
can manage your P&L also effectively. So you can look into
Okay.
that aspect as well. Whereas from a lower tech, I think we should really brand that well, because it really doesn't matter for you, if you're getting into a product or if you're getting into engineering services. If we continue to brand as precision industry with these kind of clients, I'm thinking that because India is now picking up precision manufacturing
Right.
and substituting Chinese import, I think people will come to you naturally. And
Right.
that sort of, let's see whether we can push it through IT/BT ministers, LinkedIn profiles and all that. So we'll do that. We can do that through
Okay.
ADEM. But let's make your story available first.
Right.
We'll use
So,
BOLPU as a platform
uh,
also.
yeah, I think that is something which would be really helpful for us because, marketing in this particular line without the support what you mentioned right now becomes a little challenging because people either they know us and they are buying from us, or else they don't know that this kind of machining exists in India. We are trying to push,
Yeah.
but we have limitations.
Yeah. No, we will do that.
So,
So coming from
right.
ministers' handles
Mhm.
would establish your credibility. So
Right.
that can be done.
And another thing I would like to add, you just mentioned watches. So just last week we got onboarded for Titan watches.
Acha, we work with Titan though.
Okay.
Yeah, we are their this one partners for ecosystem building.
Okay.
But my mentor is actually one of the close friends of Bhaskar,
Okay.
who was the CEO for Titan.
Okay. Okay. We were there last week in Hosur. So we've
Acha,
got
okay.
about 8 new drawings for their new watch development.
Very nice, very nice.
Right.
It's good. Yeah, I mean, I think these stories need to be really published.
Right. Right.
Perfect. So I think these two things we can do. Yeah. I think this is good enough. While he's working on the market research with the focus group, let us also prepare these this exercise, and we can see how can we launch all of it systematically, so that there is, and how do we phase the launch. So maybe because IT/BT minister is going to be there, so can we use his handles? How do we use KDM? When do we post this in terms of manufacturers? These are all some of the things that we should really think. Okay, so let's do these two things. And Jackson, even if we miss out on timelines, just let us know. Even if you feel that let's do some marketing exercise in the month of May or June. Let us know
Mhm.
all those things, because certain things we can push in terms of timelines. It's all up to you.
Okay. Okay.
But we will keep these things in our pipeline. So for us, what we're looking at is each of the stories from our cohort has to be published.
Okay.
And the way we are thinking about is some of these things, they want government orders. So we are
Okay.
using government handles as a channel to get inside government, this one. So we know some of the networks there. Some of
Okay.
these things are consumer, this one. So we are looking at, can there be some promotions using influencers?
Right.
So those are the channels. So in your case, you just need enough publicity with trust.
Right.
So any ministers doing it, talking about Mangalore as a region, and we are using that as a use case. And maybe if we can have some sort of a dental association where these things can be, you can get a slot to talk, etc. Those are some of the things we should look at.
Right. Dental
Okay,
and
so
medical. So we are not, not limiting to only dental because medical also is something components that we are already doing and would like to be in that.
okay. Mm, okay, so just think about it. Okay, not I've not thought through it well. In our college on 22nd there is an inauguration. Okay,
Okay.
and we are getting emphasis for guys to come. They have enough network. But also MC Sudhakar is coming on that day. Okay, he's actually a doctor by profession, but he's
Okay.
education minister. Okay,
Right.
if you feel that just presenting to him would make sense, then you can come on that day also, because he's in doctors association. I'm just thinking, would he connect you to somebody from the dental association or doctors association where you can
Okay.
talk? I'm
Okay.
not sure, but I'm just saying, if you feel like that would be useful,
The
I
thing
can give
is,
you a small this one.
Johnson, sorry, but 21st to 28th, I'm actually traveling with family.
Okay, fine. I'm just
Unfortunate,
thinking.
sorry, but thank you.
No problem, no problem.
Right.
So 22nd, MC Sudhakar is coming, and 23rd, Sharan Prakash Patil is coming. So Sharan Prakash
Okay.
Patil is actually focusing a lot more on manufacturing,
Okay.
especially from a skills point of view.
Okay.
But it would be interesting for us to see, what sort of connects we could have got. But I think we can explore. There are some other organizations that we know of who can get into manufacturing. Would not be, of your interest in this timeline, but definitely could be something that we can connect you in the next phase.
Because if it is government connections and all of that, for us, even supporting the defense aerospace supply chain of BEL and all of that would really help us.
Yeah. So there is this person called as Gopinathan. He would be of your help, but I'll also connect you to one of these days. Maybe when you're in Bangalore, you let me know. I
Okay.
will connect you to a person. Keep this name in mind.
Okay.
This person is called Vaikunt.
Okay.
Okay. I will send you his number.
Okay.
Okay. Karthik, I'll send you. Can you just share it with him? I've sent you that. Just look at this guy. This guy is actually the core vendor for all defense.
Okay.
Okay, and I think he's gotten into, he knows a lot of guys inside defense, and he's like a procurement guy for the defense, and
Okay.
he's keen to help anybody who has come up with anything that is useful for defense.
Okay.
Okay, so his name is Vaikund. I've sent Karthik his details, so you can we can set up one discussion with him. Just look into this guy.
Okay. Okay.
So he is saying that this industry has really opened up because of a lot of issues, geopolitical issues. So everything they are trying to indigenize, anything and everything that can help in defense, he is willing to listen and get. And he is okay with if it is a young startup, if they have just started, that is okay, and he's willing to talk. He's one of my friend's close friend.
Okay.
So Vaikund. So just you can again. This is in Bangalore, so you can meet him. You can call him. But just let me know before that. I'll ask my friend to just intimate him before you call.
Okay. Okay.
Yeah. So good. Any other things that you think?
No, I think this is good.
Okay.
A nice meeting today.
Okay. Perfect. So Karthik, let's keep that as a tight timeline. Let's make sure that these stories and all get published, but at the same time that focus group can be made available. Okay. And any other connects that you feel that you want to network with, let's know. If they are in our vicinity, we'll definitely help you to.
Yeah, essentially, I think through the platform what you've created, if Lohatech along with its capabilities is kind of marketed, that would be really of great help.
Yeah,
because
we will do that.
Yeah, the indigenization process that is happening, we are a part of a lot of companies, but we have the bandwidth to go at least 20x.
Yeah. So what I'm saying is, Jackson, so you will get those shots. Okay. So, but you
Right.
need to tell us when do you want it. Okay. So for
Okay.
example, we will definitely use ITBT channel to, or we will tag him and he will tag us back. Okay. That much we can do.
Okay.
But his focus is on mostly on ITBT. Okay.
Okay.
But we can tell that topic about Mangalore and then, precision manufacturing at Mangalore is happening. That story we can publish because he's also
Right.
beyond Bengaluru's cheerleader. Okay.
Okay.
So we can make him do that because his handles are published by KDM. So he will do it. Now, the day it comes, it will go in his handle, that is for sure. But how do you leverage it is your point. So otherwise it will fizzle out, right? So let's say, for example, I'm going to tell that on this date is going to happen, or maybe this week it is going to happen. At least you need to have those guys tagged and all that. So those things need to be ready so that it doesn't fizzle out. Like, for example, you want to tag all these HCL Tech and all of those guys. You want to tag some vendors of yours to build that, rapport with them, or you want to build the confidence with them. There might be some, vendors who are just thinking, or they're just in the auditing phase, but these things and all can become a big boost for you. Right? So those things you need to keep it ready when these things happen. So even if we try to post some videos through, let's say, captain's handles, captain will post, right? Now, how do you leverage that post becomes critical.
Right.
That virality has to happen, otherwise it will not be useful.
Right.
So you'll get those 2 or 3 shots, let's say, but you need to also be ready to leverage it. So you tell us when do you want that. During those phases, we will plan and phase it out, but we will keep the stories ready at least.
Okay. All right.
Okay. Yeah.
Okay.
Okay. Perfect. Thanks, Jackson.
All right. Fine. Yeah. Thank you. God bless. Bye.